Prazepam is a benzodiazepine used to manage more severe forms of anxiety disorders. In this video, let's found. What is Prazepam? What is Prazepam used for? Contraindication. What are the side effects of taking Prazepam? How does Prazepam work? How to use Prazepam? What is Prazepam? Prazepam is a benzodiazepine derivative drug developed by Warner Lambert in the 1960s. It possesses anxiolytic, anticonvulsant, sedative and skeletal muscle relaxant properties. Prazepam is a prodrug for desmethyldiazepam, which is responsible for the therapeutic effects of Prazepam. What is Prazepam used for? For short-term treatment of severe insomnias that are not responsive to other hypnotics. Contraindication. Benzodiazepines require special precaution if used in the elderly, during pregnancy, in children, alcohol or drug-dependent individuals, and individuals with comorbid psychiatric disorders. Side effects. Side effects of Prazepam are less profound than with other benzodiazepines. Excessive drowsiness and with longer-term use, drug dependence, are the most common side effects of Prazepam. Side effects such as fatigue or feeling spacey can also occur, but less commonly than with other benzodiazepines. Other side effects include feebleness, clumsiness or lethargy, clouded thinking and mental slowness. Pharmacodynamic. Prazepam is a benzodiazepine derivative with anxiolytic, anticonvulsant, sedative and skeletal muscle relaxant activity. Benzodiazepines may be habit-forming, causing mental or physical dependence, especially when taken for a long time or in high doses. Mechanism of action. Prazepam is believed to stimulate GABA receptors in the ascending reticular activating system. Since GABA is inhibitory, receptor stimulation increases inhibition and blocks both cortical and limbic arousal following stimulation of the brainstem reticular formation. Half-life: 36 to 200 hours. Dose. Anxiety. Adult, for cases that are severe, disabling, or subjecting the patient to extreme distress, 30 mg daily as a single or in divided doses, may be increased to 60 mg daily according to patient response. Usual dose range, 10 to 60 mg daily. Use the lowest dose that can control the symptoms. Max treatment duration, 4 to 6 weeks, including tapering off process. Elderly, initiate at a lower dose or a dose of no more than 15 mg daily. May increase gradually according to patient response. Safety advice. Animal studies have found Prazepam taken during pregnancy results in delayed growth and reproductive abnormalities. That's all the information about Prazepam we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.